think of Amber? I screwed up a diagnosis. You don't seem that upset by it.
Diagnosed a guy with adenocarcinoma 3 months ago. Told him he had 6 months.
So now you better tell him that he's way behind on his Christmas shopping.
He didn't get worse. I rechecked everything. Biopsy was a false positive. Harmless lesions caused by talc inhalation.
Medical clemency. Interesting.
Why would you use that word?
Because I'm interested.
Whenever a doctor is interested in your case, that's a bad sign. Doctors usually get interested in cases that are difficult for the patient, but are mentally stimulating for them. Anyways, going back here, so this is a good sign for the patient. The patient didn't have lung cancer. Here, Dr. Wilson's one of the patients was diagnosed with lung cancer, but he had a talcum inhalation. Talcum is something that is present in the environment. Usually it's mixed with asbestos and sometimes without asbestos. So it can be inhaled and goes to the lung. It can lead to some changes. But I didn't find any evidence that talcum inhalation can lead to false positive result of the lung biopsy that can present as adenocarcinoma. That being said, you never know. There might be some lung lesions on the imaging that they were biopsied, and based on the history, based on the appearance of the lesion, the patient was diagnosed with lung cancer. But what are the types of lung cancer? Let's talk about the lung cancer types. So we have 4 types of lung cancer. We have large cell lung cancer, we have small cell, we have adenocarcinoma, and we have squamous cell lung cancer. Not every lung cancer is caused by smoking. Lots of people get lung cancer without any history of smoking. And this is something important to know, that there is a misconception in the community or in the world all over, that people, when they see someone who is diagnosed with lung cancer, immediately they think, oh, you did this to yourself. First, we should not blame anyone for their diseases, like when we don't blame people who have a heart attack on their diet and if they didn't exercise, so we should not blame people with lung cancer. And the second thing is, not every lung cancer is caused by smoking. There are some lung cancers that are driven by specific mutation or a gene. An example here is adenocarcinoma. So lung adenocarcinoma is not usually caused by smoking. For some reason or other, some people they have a mutation, and this mutation can lead to lung adenocarcinoma. And we do have a specific targeted therapy, and that's why every patient, when they are diagnosed with lung cancer, we should test for specific mutations. If they have a mutation and we do have a treatment, we might use targeted therapy or immunotherapy, and we don't use chemotherapy. And if they don't have a mutation and they don't have a specific target for immunotherapy, we might use chemotherapy. So in this case, the patient was diagnosed with adenocarcinoma. And remember, adenocarcinoma is not related to smoking. Let's continue watching.
When I'm interested, I describe the things that make me interested as interesting.
Most people would say good, possibly great. Why aren't you able to just enjoy
Why
it?
aren't other people able to just be interested?
Never a good sign the doctor is interested.
I got your new test results back.
Sorry, Mike.
Oh, this is unprofessional. Usually doctors don't interrupt each other when we are giving bad news or we are giving good news. This never happens. Or rarely happens.
Who's your colleague? Dr. House.
Yes, Dr. Wilson.
I really don't need the consult. I know the prognosis.
Apparently not.
Mr. McKenna, I can't believe I'm able to say this, but you're cancer-free. The biopsy looked like adenocarcinoma, but it wasn't. Harmless lesions on your lungs. You're fine. I don't get it.
Cool.
No, I know this must come as a shock, but
Accepting the diagnosis of cancer comes with stages. It's not easy. And it takes lots of planning. And here, the patient was shocked, which I do understand, because now they went through serial stages from denial to anger to acceptance, and now everything is reversed. So it creates a huge emotional turmoil. So I do understand where the patient is coming from.
as a shock, but I've double-checked the labs.
I just accepted an offer on my house. I've had 3 goodbye parties. I'm buying plane tickets to Venice.
You can still use those if you're alive.
I have to pay a $6,000 broker commission on a house I'm not selling. Money I don't have.
Here I want to comment on an important thing. The financial toxicity of cancer. Cancer is not only a disease that you get diagnosed with and you take a pill a day and that's it. The problem diagnosis and the treatment of cancer come with financial toxicity. First, this patient thought they're going to die. So they sold their house, they had a goodbye party, they booked vacation, and they spent everything they have. One. Two, the treatment itself, when you get treatments like whether it's chemotherapy or immunotherapy, you have to take time off from your work and you have to go to the chemotherapy center, the infusion center, and you have to sit there for X amount of time and you have to get the infusion. Or if you're going to be treated with radiation therapy, you're also going to take some time off and you have to go to the center, to the hospital, or to the university where you're going to get the radiation therapy, right? And that takes time off work, and usually people take time off work because you can't balance both cancer treatment and work itself. And because also cancer treatment, usually, unfortunately, it doesn't end with the infusion of the chemotherapy itself. It can lead to some fatigue. Not everyone experiences it. It can lead to some diarrhea. It can lead to vomiting. Not everyone experiences it. But there is a financial toxicity that comes with the treatment of cancer. The second thing here I want to comment, but let's watch a bit so I can point a very important take-home idea.
Thank you for letting me know.
I would have thought the living would mean more than the expenses.
It's not about the money.
It's not about the money. When you tell someone that they have X amount of time on earth, they start enjoying life and they start spending time with the people they love. Because at this point, you understand that the most valuable asset you have in your life is time. And now that person started enjoying life and started tasting things that he didn't taste in the past. And it's not about the money. He started enjoying life and now he's going to go to work again, probably. He's going to be healthy. He's going to be a productive person in the society. But that also takes from the time that we spend with the beloved ones. It's very hard dilemma. I don't know how to sort it out.
I can't apologize enough to you, to your family. There may not be any technical liability here, but you're ripping it up because you think it would be wrong to take money from me?
I think it'd be wrong to take so little money from you.
You're out 6,000.
You ruined my life.
I ruined 3 months.
For the first time in my life, I was living in the present. Because that's all there was.
You're suing me, not for the wrong diagnosis, but for the right one? Have you spoken to a lawyer?
You gave me happiness. And then you took it away.
Never give money to a patient. So this doesn't happen. I never witnessed any physician give money to a patient. Probably here Dr. Wilson was feeling really, really, really guilty, but again, this doesn't happen. And the patient here highlighted important point. You made me live in the present moment. And this is something I also struggle with. It's very hard to live and experience the present moment. We are always occupied. At least I can talk about myself. I'm always occupied about the future, about the things I have to do, about the things on my to-do list, about the things I have to achieve. And even when I go to visit my parents or I spend time with my partner, sometimes I find myself on my phone and scrolling through my to-do list or scrolling on YouTube or scrolling on social media. And I am trying to be more cautious about being in the moment because being an oncologist is very eye-opening. In one room, you might go and tell a patient that their disease is cured. Another room, you might tell a patient that they are in remission. Another room, you might tell a patient they have a year to live. And this is every day. This is a reminder of how life short can be and how much surprises life can sometimes bring. So take-home point is be present in the moment. You never know what happens. Things I liked about this episode is it really showed the financial toxicity that cancer can have on people. Also, it is right. When you are diagnosed with cancer, you start like counting the days and how important it is for you and to spend them with the beloved ones. And it does really change your perspective on life. And that's what I try to always tell myself and tell my beloved ones, like, try to live in the present, as much as cliche it sounds, as much as hard it sounds, but try to live in the present, because you never know when life can change. I'm not saying don't plan for the future, don't be ambitious, but also don't take the moment for granted. I hope you liked this video. If you have any comments, please leave them below. If you have any episodes or movies that have cancer scenes and you want me to react to them, please leave them in the comments below. And please hit the subscribe and the like button so more people can see this content. Okay, I will see you in the next episode. Stay healthy.